putting your head in the sand doesn't help. So very much this not doing anything about it doesn't change the fact it's happened. Going and seeking help gives you a much better chance of, so catching cancer early is really where I'm coming from, or even starting treatment. I do think there's that step before where if you're worried at home that you've got something, worrying about it doesn't do anything apart from taking the time away from you of enjoying life. Going and dealing with it is much more important. And then absolutely that word, as soon as it's out loud, is scary. Let's face it, cancer treatment, there are no easy cancer treatments. Mine's great, but there's still side effects to it. But would I prefer those side effects to not being here? Abso-bloody-lutely.
Hello, welcome to Breathe Strong. I'm your host, Rachel. Breathe Strong is a space for honest conversations, shared experiences, and real stories from people living with lung cancer and mesothelioma and those who support them. Before we begin, it's important to be clear that the conversations, stories, and views shared within this podcast are based solely on personal experiences. They are not intended to provide medical advice, diagnosis, or treatment, and should not be relied upon as medical evidence or factual guidance. Always consult a qualified healthcare professional regarding any medical concerns or decisions related to your health and treatment. Thank you for being here. I hope you enjoy our podcast and find it beneficial. Hello, my name is Rachel, and I'd like to welcome you to our podcast, Breathe Strong. Today, I'm just going to introduce you to patients I have with me in the room here. But first of all, I'll just give you a little bit about me. I'm a mesothelioma and lung cancer nurse specialist. I've worked at some of the large teaching hospitals in London and have been a specialist nurse in this field for about 20 odd years, although I don't like to admit that because it shows I'm getting old. I really enjoy my job. I've worked with clinical trials. I've looked after patients from all points from diagnosis right through to end of life, having also worked in several hospices. I first came up with the dream, I suppose it was, of a podcast that is patient-led, because I feel that our patients often don't have a voice, and I want to bring patients together across the whole of the country to share their experiences, because I feel that by doing that we can be really strong and help alleviate a lot of fear and anxiety around lung cancer and mesothelioma diagnosis. So I'm just going to now introduce you to my lovely patients who've come along today. So the first person I'd like to say hello to is Doug. Hi, Doug. How are you?
I'm fine today, thank you.
Brilliant. And we'll go on a bit later on to talk about diagnosis, but maybe you'd just like to tell us, Doug, are you married?
I am, yeah. I've got my wife, Barbara, 3 sons, 3 grandchildren, and yeah, we're all okay at the moment.
Good, lovely.
They're very supportive, especially my wife. In fact, I don't think I'd be here if it wasn't for her in the initial stages. So, yeah, we live in our own house. We've got a nice motorhome, which we get out in as much as we can. And, we do what we can when we can.
Brilliant. Thanks, Doug.
Good days and bad days.
Yeah. Okay, thank you. And welcome to our podcast, Doug. Hi, Leslie. How are you? Would you like to tell us a bit about you?
Okay, yeah, my name's Leslie. I live in southeast London, so not very far for me to come today. And I'm single and I live on my own. No children, but I have all my family actually live down in Cornwall, but I have an amazing support network in and around London, and actually my family have been amazing as well since I've been diagnosed. I'm still working. Haven't been working as much over the last couple of years, but sort of hoping to get back to working a little bit more in the new year. Yes.
Thanks, Leslie, and thank you for coming to join our podcast. So next we've got Charlie. Hi, Charlie. How are you?
Hey, I'm good today, thanks. How are you?
Brilliant, thank you.
Perfect. So a little bit about myself. I am married to a lovely lady called Maxine, known as Max for the rest of the time. She's also been a massive support network to me since diagnosis, and definitely prior to that as well. We live in a great army town, Aldershot, just outside, with our couple of dogs and a cat. And that's probably it for now.
Sounds brilliant. Sounds quite idyllic. So I just want to get people's thoughts about, what it was like to be diagnosed, because I think as a nurse, we give these diagnoses, we sit in diagnosis with doctors all the time, but we actually, I would say, don't really fully understand it, because how can we if it's not us that's got the diagnosis? So just really interested to get your thoughts about, what was it like when you were diagnosed with mesothelioma and lung cancer? Maybe Charlie, you'd like to tell us first, about that first experience of sitting in that room opposite that doctor and the news is given.
Yeah, I'm very happy to talk about it. For me, it was slightly probably different to most people's diagnosis story, because it was the second time I've been diagnosed with cancer. So the first time I was at Sandhurst training to be an army officer, and I was diagnosed with stage 2 Hodgkin's lymphoma. And with stage 2, there was never any really mental battle for me in terms of, I did 6 months chemotherapy and moved on with my life, literally,
Right.
which I look back on now and just go, I'm not quite sure how I did that, but I did. So this time round, hearing the words stage 4 lung cancer as a non-smoker was devastating, if I'm really honest. It was not a cancer I thought I was at risk from. Because of my previous cancer history and my family history with cancer, genetically we're more predisposed to certain ones, but lung cancer was not one that we were screening for or
Right.
prepared that I was about to be diagnosed with. And to hear stage 4 at diagnosis was really quite shocking.
Yeah.
I was a basically fit 44-year-old army officer still serving, just come back off a sports tour. So I was genuinely relatively fit, doing, living life, and then stage 4 cancer diagnosis and lung cancer diagnosis.
Wow. And when the health professional, the doctor, gave you that diagnosis, what sort of language how did they break that news to you?
So I kind of got my diagnosis in a couple of parts, but I'll stick with the oncologist conversation because I think that's probably the clearest for this. My oncologist was excellent, actually. I have great respect for anyone in this field, to be fair, but this particular person, she took 45 minutes. She went through the PET scan at detailed level with me and my wife. What I didn't mention earlier is my wife was a combat med tech in the army, and I come from a medical background. I am not medical, but I come from a medical background. So actually, I want to know the detail almost straight away. And for me, that helps me understand what's going on. So she was brilliant. She took us all the way through the PET scan. So PET CT. She took her time getting my story. Because of the previous Hodgkin's, there was querying over whether I'd previously had radiotherapy or not for various reasons. I hadn't. There was the, smoking history questions and different bits and pieces, because at this point we didn't know it was a mutation-driven lung cancer. So all of that detail at the beginning is so important for the care team to be doing the right tests. So post the diagnosis of non-small cell lung cancer, there's various different versions of it. And depending on your history, can sometimes depend on what version you have. And so for me, once you've been told stage 4 lung cancer, to then be told you've got a mutation-driven lung cancer and there's actually a targeted treatment for it, that's actually good news in this whole sphere of life by the time you're in this bubble. So she went through the tests that were still to come.
Okay. So there was some hope there for you because
Yeah,
of
definitely. Definitely. So the words that all of us have heard as a stage 4 lung cancer patient is incurable, inoperable. But with that onco-driven gene, I then heard the word but treatable for now. She also left the door open because as a stage 4 patient, you're generally not given surgery. But she also left a slight door open for me, which was at the moment.
Okay.
And I remember those words because it gave me, from the outset, a bit of almost an earworm, a brain worm to hold on to that. So it's not operable for now, but we'll see how the treatment goes.
Okay, brilliant. And Leslie, what you know, from a mesothelioma perspective, what do you remember about your diagnosis? I mean, you're young. Most meso patients tend to be sort of older. So how was that for you?
Well, for me, I started off obviously. First, they started throwing around things like, could I have TB? When I first went to the hospital, obviously because my lung was sort of full of fluid, and first they had to sort of drain all of that. And before they sent me for my biopsy, they started asking me if I'd ever had any exposure to asbestos, and I said, well, I don't know, I had no idea. And had I heard of mesothelioma? And no, I hadn't, obviously. And then, of course, then you go away and you Google it, which is one of the things I'll say, don't ever do that. And that's when obviously I saw that mesothelioma was a type of cancer.
Right.
And that's when I was sent off for my biopsy. And I was given my diagnosis by my surgeon, actually. And I actually did have my parents with me.
Right.
Because they said they wanted to come with me just in case. And I was actually given quite a lot of information, and I was okay with the way my diagnosis was given to me, apart from obviously when you're told that it's an incurable cancer. I wanted to be given that information by myself. I didn't want my parents with me in the room. And then I told them to come in after that, because I know what my mum's like. She's a bit of a crier, bless her. And I think I knew before I was told that I had it, that I had it. I don't know. It was
Right.
just like a sixth sense kind of thing. And I don't quite know how I think I went away feeling quite numb, to be honest, and I needed to know a little bit more about it. Obviously, they start throwing around asbestos, and that was a thing we couldn't get our head around. You know, where did I get it from? And how have I got it? And obviously, yes, being a female. Obviously, last year, how old was I? I was 53 when I was diagnosed, and I'd literally the year before, I'd done a 36-mile walk, and, fit and healthy, go to festivals, used to being really, really active in my life, to go from being active to not being able to do anything at all, not being able to walk up the stairs at the tube station, was quite distressing for me. But, you just, I guess, if I can give anyone any advice, is to not look for Dr. Google, or not Google mesothelioma, because there's not a lot of positive information online. I mean, a year and a half from my diagnosis, and I'm still feeling fine at the moment. So
Good.
I'm trying to sort of take the joy from every moment that I can at the moment.
Good. And just talking about that, you know, I hope you don't mind me saying you are slightly older than the girls here. But had you heard of mesothelioma before?
No, I hadn't heard of it at
No?
all. No, I mean, my diagnosis started with I had a pain in my left shoulder, which we went to the doctors and they sent me off for an X-ray, which never did get the result, unfortunately. But they thought I'd got a cracked rib,
Right.
Oh, wow.
so that's what they were, treating. Excuse me. But it got so bad that my wife took me to A&E, to a different hospital.
Right.
Sort of 2:00 one morning. Had X-rays, a scan, and the usual things, and then off to the next day they phoned up and said they'd found something. Could I come back again? So, and from there I was referred to the respiratory department, which were very good. They tested just about everything, you know. Did I smoke the same as the others, which I had done until I was about 30. But my actual lungs, he thought I'd never smoked. So the actual inside of my lungs were perfect, really. Then from then on, they sent me to the oncologist. And as soon as I mentioned I've been in the motor trade all my life, asbestos from the brake shoes and brake linings and clutch discs and what have you. Then the next time I saw them, they said, yeah, you've got mesothelioma. And we both looked at him and looked at each other and thought, you know, what's that sort of thing. And his next words were, it's not operable. So, you know, I thought that was it was a bit blunt, to be honest. And yeah, things just went on from there. You know, I was a bit numb. I think the wife took it worse than I did. And of course, when we told the boys about it, you know, individually, they weren't all in the same place at the same time. I think one in particular was really, you know, upset, worse than what we were, I think.
Right.
And then, of course, the more you learn about it from the oncologists and the nurses, etc., you just realise you've got it and that's it. You've got to get on with it.
Yeah.
At the same time, he more or less, he said, well, you can have immunotherapy or chemotherapy. I thought, well, we've never heard of immunotherapy. But he didn't really explain much. He just wanted there and then for me to say which one I wanted.
And was that in the same appointment where you'd just been given this
Yeah,
diagnosis? So
it was, yeah.
you got given this massive diagnosis and then they started straight away talking about
What treatment did I want? Yeah.
And was that the same for everyone?
No. But the oncologist, I don't want to be rude or anything, but I don't think he was the best at the time.
Right.
Luckily,
okay.
he left and we got a new one, and she's absolutely brilliant.
Okay.
Got time for you. You know, every time I go in after I've had a scan now, she'll sit there and talk to you, and if she, you know, if it's a phone consultation, she's, you know, on the phone, then you can ask her anything you want, and she's really brilliant.
Good.
So
good.
I'm pleased with that.
And just thinking about diagnosis, I know a lot of my patients say when I go and visit them at home, they talk about they can't remember things. So I'll have read clinic letters and know that information's been given. But like I'll sit in the house and I'll say, so, you know, what type of mesothelioma or even what type of lung cancer have you got? And patients will say, what do you mean? What type? I've got lung cancer or I've got mesothelioma. Did you find when you had to tell your family that there were bits that you couldn't remember, that maybe when you went back into the hospital, they said, oh, we told you about this last time maybe, and you thought, well, I don't remember that.
No, he just said I'd got mesothelioma.
Oh,
He didn't
okay.
say what type.
No.
No, I was told,
Leslie?
and I think I tried to write it down. Of course, you can't spell it. Is it epithelioid mesothelioma? And I was like, oh
That's
my goodness,
easy for you to say.
Yeah, exactly. And then it's like, don't ask me to spell it. So
Yeah.
But no, I if you can say lucky, I've been quite lucky down the line with all the people that I've seen, to be honest. And I've been quite clear in that I've always taken a notebook with me. I've either had a friend with me or a nurse has come with me to every appointment. So I've been quite lucky in that respect. But I've always, I've sort of written down and I've made sure I'm quite clued up on everything that I've got and what road to go down, really.
Yeah. Charlie, what about you? Because did they explain, you know, because to me the words, oh, you've got a lung cancer that's got a molecular mutation. I mean, we trip those words off our tongues all the time as healthcare professionals. We blindly think that everybody knows what we're talking about. But was that explained? Because I can imagine, and I'm just saying imagine because I don't really know, did you understand what the heck they were talking about?
I did, but I don't think it was because it's explained to me. So that I basically had a week knowing I had stage 4 non-small cell lung cancer, adenocarcinoma, but we didn't know what the cause of it, not the cause, wrong word, but what the type. So whether it was or wasn't onco-driven. And so in that week, I then started to research, and I smiled when you said about don't Google.
Yeah.
That it's true, but equally for me, not knowing is almost as bad as knowing.
Yep.
But you do delve into a world you do not want to be reading about. But that helps me. It might not initially, but then my brain kind of calms
Yes.
if it's got. So even if it's facing the worst news, it's almost better if it knows it. I can't quite describe it.
I get that as well. I was
Yeah.
actually talking to a friend about this the other day, and we was if like I say, don't Google it, but she said that's the first thing she did was she Googled it,
Yeah.
and she was like, oh God, no, we need to go and do all the things that you need to do in your life now, because she thought I was going to be gone in 6 months' time.
There was
as did everybody.
Yeah, exactly.
Okay.
Before we knew that mine was onco-driven, and before we knew there was a targeted treatment for it. So I have stage 4 EGFR positive cancer, exon 19 deletion. And in that week, I'd actually searched almost everywhere and any link to lung cancer, non-smoking lung cancer, different bits and pieces. And so that week, I became almost an expert overnight from a patient perspective on mutations and which one had treatments and which didn't. And I actually had a phone call from my oncologist. So I'd been in clinic on the Wednesday afternoon, and my tissue sample, so I was diagnosed by a needle biopsy, and the needle biopsy was then looked at but actually came back with no mutation, the first part. The second part, I've since found out, came back with EGFR. And so when I was in clinic, the first part had come back with no mutation.
Right.
And they actually booked me in to start chemo on the Monday.
Okay.
Wow.
So this was a Wednesday, started booking me in for chemo. I went home with a prescription for folic acid in preparation to try and get I had 4 days, but to try and do everything I could to get ahead of chemo starting. And then that night I received a phone call in the bath, 6:30 after hours. The oncology team had been ringing the lab. Luckily they'd done what's called a PCR hotspot test. And I also had a ctDNA, so a blood liquid biopsy done. And both of those came back with EGFR positive, which then meant I didn't start chemo. I started a targeted therapy, and the difference in those two things is dramatic.
Yeah.
So
that must have felt immense relief in a way, was it? That
amazing.
You got that.
I've got a photo. I've got a photo because I was in the bath. I was also trying to celebrate that night. So I was about to leave the army, and mine and my wife's best friend, Liana, was also leaving the army on the same day. And this is one of those sliding doors moments in my story. Liana was with us. She'd had a job interview that day. She'd got the job. We'd come home from oncology, didn't know where we were. I was looking down the barrel of starting chemo. We sat around the dining table. I'm trying to get into that positive mindset to celebrate for my friend, and I couldn't. I was in a very, very dark place that night.
Right.
So I took myself off to the bath because it's my happy place, water.
Yeah.
And I was in the bath, and I was actually having a very long conversation with my sister. And the oncology team were trying to ring. I didn't know that, so I was chatting away to my sister, offloading, let's say. And my wife was banging on the bathroom door going, you've got a phone call. And I was like, I'm on the phone to my sister. And my wife was like, you want to take this phone call. So she came in, gave me the phone. It was the wonderful doctor that had taken so long the week before, telling me and as soon as she said EGFR exon 19, I knew there was a treatment for that one.
Wow.
Because of the reading I'd done. So from that moment, and there's a brilliant photo of me in the bath, like celebrating the news that I'd got EGFR.
Gosh. It's amazing the difference there between your thoughts about having to start chemotherapy and all of what's associated with that, and then to have that news, to have a treatment that can potentially give you a really better outcome and life expectancy must be.
I can't describe it. And I was chatting to some people the other day in a group, and it's around, like, I have done 6 months chemotherapy before, but even that chemotherapy was 6 months. There was an end state, and I could mentally fix on that end state.
Okay.
But I think the fright for me with chemo with stage 4 lung cancer is there's no end state to that. That's the treatment you're going on to. And the amount of difference chemotherapy versus the treatment I am on in life. So I literally take 1 tablet a day anywhere in the world so I can keep travelling. I can live my life. I can thrive, not just survive. And it's such a big difference. And I am also very lucky. There are side effects to this treatment, but for me, they're more than manageable with, normal, I'd say everyday drugs. Not quite that simple. Again, stage 4 cancer life, everything becomes normal, which to most people would seem absolutely crazy. But, the side effects for me are really manageable and I'm able to live my life.
Brilliant. And what so in mesothelioma we have to start with immunotherapy. So what's been, when you were told that you were going to have immunotherapy treatment for you, Doug and Leslie, what was that like? Did you understand what those drugs were? And
No, not really. But to start with, actually, I had 10 sessions of radiotherapy down at Southend Hospital, which was supposedly to shrink it a bit because the pain in the shoulder, excuse me, was pressing on a nerve. And I had 10 radiotherapies, which after about the second or third one started to ease the pain. But it was very difficult because when you have radiotherapy, obviously they put you in what I used to call me straitjacket, and you've got to lay still. Well, of course, this shoulder kept all the time, so I had to have liquid morphine every time I had the treatment for the first 3 or 4, and then after that it was okay. But yeah, but no, I hadn't got a clue what immunotherapy was really. It's just that we chose that over the chemotherapy, and it seemed to work.
Okay, good.
I wasn't really I wasn't really given a choice in that I was asked if I wanted to join a trial.
Right. Okay.
And I ended up getting the sort of standardized treatments. I think they call it, is it the control arm or whatever?
Yeah.
I think. Anyway, I ended up getting the standard immunotherapy treatment. And for me, I went away and did all my sort of research on it and just sort of, I was aware of certain side effects. And unfortunately, my first round of it made me quite poorly. So then they had to sort of stop it after the first one. And so I stopped it for, goodness, a good sort of a good couple of months actually.
Wow,
and it was
okay.
touch and go whether they were going to actually start any treatment again. But then they did. And then I sort of carried on with that for, I think nearly a good 8 to 10 months, I think it was.
Okay.
But then it stopped working. It worked to start with. It started to shrink it a little bit, and then it stopped working. And then I was told that they were going to start me on chemotherapy.
Okay.
So I was okay about starting the chemotherapy actually, because the immunotherapy, I ended up with quite bad side effects on mine. I had crippling arthritis for for the whole time that I was on the immunotherapy, which meant that me in my active life, I couldn't do anything. I was quite depressed, actually, really depressed. But as soon as I started the chemotherapy, completely cleared the arthritis up. So I've actually just finished the chemotherapy a couple of weeks ago.
Oh,
So
brilliant. Well done.
fingers crossed.
Yeah.
Nothing for a while now. So yeah,
Wow.
we'll wait and
Good.
see. Yeah.
I think this immunotherapy, a lot of people do react to if they have the 2 drugs to start with. I mean, I did after the first one. I was covered in a rash, as you know, Rachel, which I've still got. They never get rid of it. And after the third one, I was so ill that I had an oncology appointment, and the wife took me in a wheelchair. I couldn't walk. I lost about 3 stone. I was in bed, for about 6 to 8 weeks. If I never see another banana smoothie in my life, it'll be too soon.
Oh, bless you.
But she's brilliant. She used to come in every hour and wake me up and feed me.
Oh my gosh, you're that poorly. Wow.
Yeah, terrible. Yeah.
Gosh.
And that went on for about 8 weeks, I think.
Wow.
But obviously they stopped the treatment.
Yeah.
And when I restarted, it was just on one.
Okay.
Which
was better.
Yeah.
Okay.
And I finished my 2 years treatment January this year.
Oh wow!
Congratulations! Brilliant.
Just a scan every 12 weeks.
Brilliant.
And I just had the last results, and it's still stable.
Oh,
So
fantastic!
Well done.
Really brilliant.
Yeah.
And just going back to diagnosis, one of the things that a lot of patients used to say to me is, if they didn't come with family members, a lot of patients do come with somebody, but they might have children at home, or other relatives at home, and one of the, I suppose, angst was, how on earth do you tell your relatives, your friends, that you've got a cancer? It's not curative, and without them suddenly treating you differently. I mean, what was your experience of telling friends and family about your diagnosis?
So the hardest thing was to tell my mum, if I'm honest. However, there's a slight silver lining / reframing with this, because I was actually diagnosed with the stage 4 lung cancer because I'd coughed a blood clot up. And so I went to my GP. My GP was excellent. Again, knew my family history and my history. I described my symptoms, and I'd had some extreme shortness of breath, but only on exertion. So I looked completely normal, looked completely healthy. I'd just come back off holiday, so I looked, tanned, absolutely fine walking down the corridor, etc. But I found that walking one flight of stairs, and I was at height at the point, so I was up a mountain, not very high, but up a mountain, walked up one flight of steps, and I almost couldn't make one flight of steps. And yet I was walking on the flat. I was literally going hill walking. So it was very, very odd. And I actually consider myself lucky that I coughed up this blood clot, because the shortness of breath I'd logged, I was going to go to my doctor, but it probably would have taken me longer than it took. So I went out to visit my sister in Spain, had this shortness of breath, thought I need to speak to my doc. Flew back in on the Friday night. On the Saturday morning, I was in the shower and shampoo in my hair, all the rest of it, coughed, and it must have felt weird. I coughed up into my hand. And because I had shampoo in my eyes, it actually looked like a caterpillar to me. And I'd been out in the back of these mountains walking, so I was like, maybe I've got something weird. Anyway, put it in the sink, carried on with my shower, and my wife came in, the combat medtech army, and I said, don't wash that down the sink because I'm finishing off my shower. And she looked at it and said, Charlie, that's a blood clot.
Did she?
And because of her profession, she had access to a few doctors on WhatsApp.
Right.
So took a photo, she dissected it, sent some photos to a very good friend of ours who said, yeah, that does look like a blood clot. You need to go to A&E.
Oh my God.
We had places to be that day. So we went to our friend's dine out up in Catterick. So Guildford to Catterick back to Guildford on the Sunday. And I went to see my medical officer, my GP, on the Monday.
Wow.
Who did some standard tests, all came back completely normal, but said, if you don't go to A&E, I'm not going to sleep tonight. So I literally went straight to A&E.
Okay.
And this blood clot, I mean, I'll jump into this now, but ultimately A&E did not diagnose me.
Okay.
Because I was young, 44, non-smoker. I did not meet the protocol for them to do a CT scan, or at least that's what I was told on that night. So because I was a non-smoker and under 50, they would not do a CT.
So even though you'd coughed up that blood,
Absolutely,
because of that demographic, you weren't considered to be cancer risk.
So they did. To be fair, they tried to do all the checks for a DVT.
Right.
So they did a D-dimer test, they did a chest X-ray, they did an ECG. All of these things came back normal.
Okay.
But and I need to do a PALS complaint, to be fair. I've not done it yet, so that's my fault. But ultimately, the more I think about this, the more I'm going, but you didn't need to check for thrombosis. I'd coughed up a blood clot.
Yeah.
But they were still doing all of the tests and they came back completely normal. And the chest x-ray I was told was actually clear. But 12 hours later, it was actually seen there was a shadow on that chest x-ray.
Oh my gosh.
It took them 3 weeks to phone me back to get me back into hospital. But when they did when they then called me back to do a chest CT, I had multiple bilateral PEs. So I had a large number of blood clots in both lungs, like more than they actually bothered to count.
Oh my
So
goodness.
I keep saying I was, relatively fit. I've always been very chunky. I'm a rugby player, front row. So I don't necessarily look that healthy, but actually I've got a very much newfound respect for my body's fitness going through this journey
Yeah.
because
wow.
it literally kept me, I was almost
Yeah,
symptomless.
you're right.
You are right.
Definitely.
Yeah.
Absolutely. I feel the same
Yeah.
as well. If I wasn't as sort of fit and healthy at the beginning,
Yeah.
having that amount of, because I went in obviously with breathlessness.
Yeah.
And they sent me for a chest x-ray straight away, and that's when they said, oh, you need to they actually didn't give me the results right away, which was, I don't know why. They left it a week. I had to phone back and tell them. They said, oh my goodness, you actually need to get yourself to A&E right away
Yeah.
because your lung is completely full, your left lung is completely full of fluid.
Wow.
Yeah.
And then they actually sent me home because it was Easter weekend. They said, well, there's no one here to drain it, so we're going to send you home. But if you get worse, come back in again.
Yeah.
So I actually went back in again on the Monday, and that's when they admitted me. And they over the course of about 3 or 4 days, I think they drained about 3.5 litres of fluid from me.
Wow.
And that's when they kept me in, and they were very good. They did loads of testing. They sent all the samples off to the labs and stuff, and that's when they started throwing around the mesothelioma.
Right.
But the family and friends, obviously at that time, we weren't even thinking cancer related. We
No, I
thought
was gonna
we
say,
thought TB, because I did a lot of travelling.
Yeah.
When I was younger, and apparently it can lay dormant. That can lay dormant for about 30 years. So we're thinking, okay, well maybe when I was travelling around Asia and stuff, I picked up some kind of weird disease,
Yeah.
and this is what it is. But my family were like, well, they were quite blasé actually, not in a bad way, but they, we just didn't think it would be that at all.
No.
Okay. So kind of you were thinking that of other things, both of you,
Yeah.
similarly,
Yeah,
but not thinking, oh my golly, is this cancer?
yeah.
When I researched the reasons for coughing up a blood clot, unfortunately, my little internal radar started to go off. And as I said, this is my second cancer journey. So, yes. And that's actually almost why on that Monday night when they said, there's nothing wrong with you, go home, I was literally skipping out the door.
Okay.
Because, and this is actually quite an important point, when you're told by a healthcare professional there's nothing wrong with you, you then start to go, oh, I must be imagining my symptoms. And also, 44-year-old female, you start to go, it must be perimenopause, because there are so many symptoms to
You
that.
do
So I was like,
yeah,
right,
you do think
okay.
that, don't you?
I don't get them.
No, but
Yeah.
and it's so. I apologise. I didn't actually answer your question. When I was chatting to my mum to tell her my diagnosis, that was the one thing I could actually say to her is, Mum, this could be so different. Remember, I'm here telling you this. And my mum is a nurse. My dad was a doctor.
Right. Wow.
So to
okay.
know that I'd got all of these pulmonary embolisms, and actually, thank goodness, none of them had moved, none of them had blocked anything off. I was and I am, as you see today, completely, again, fit and healthy with a stage 4 diagnosis,
Yeah,
but fit,
I
healthy,
think
able to say
the
that to
fitness
mum.
bit is a lot of it. I mean,
Yeah.
we used to walk, miles every day. I mean,
Yeah.
we've cycled around most of France, and we used to cycle ride a real lot, but 4 to 5 miles every day. We used to walk, and it's
I
Important.
think it is very important
Yeah.
to keep that up.
and we still do
definitely.
walk every day.
Yeah.
She puts me lead on and takes
Good for her. Good
takes
for
me
her.
out.
We like that. We like that. And I suppose for some other patients who may not be so fit, they might not really cotton on, do you think? That
No, I think
my advice for them is you might not be fit now and you might not feel like it, but start.
Yeah.
Start what you can do now, because every day will get slightly better. And I know that sounds really almost like preachy, but there's more and more evidence out there that exercise helps
really
Yeah.
the body
when I was
fight
really
the cancer.
ill, if I used to get up, because I used to play in the lounge and watch the telly between going to sleep.
Yeah.
Every time I got up to go to the toilet, she made me walk around the dining room table.
Yeah.
Twice.
Okay.
Well, once to start with,
Yeah.
and then twice, and then when I come back, I had to walk back round it again. Just to, and she gradually
She was
built.
like your personal trainer.
And Doug, you've said it a couple of times. Do what you can when you can.
Yeah.
That's ultimately
you just got to listen
And if
to
you
your body,
can't do
haven't you?
it, and you know you can't do it,
Don't do it.
Yeah.
Yeah.
there's no point in in putting yourself in more problems.
Yeah.
But whatever you can do, get on and do it. As I say, we still walk, not as far as what I used to, and I do have troubles on my bike because my balance isn't very good, and I do tend to fall off a bit.
You need stabilisers.
Stabilisers.
And do you think that since having a diagnosis of lung cancer, I know that a friend of mine, her friend recently had advanced breast cancer, and she didn't want to tell people because she said, I don't want to start looking at me differently. Is that something that you guys can...
No, I didn't. No, most of our friends, we told them, and they just carried
Still
on.
treat you as done.
Yeah. Just said to them, just carry on as normal. I don't want no.
I'll
have all the chocolates and the treats, but I don't, but the other bits.
Yeah, I've said that to people as well. Don't treat me any differently.
No.
I don't, I think I have struggled with that because, it's about trying to find a new me, I guess. And I don't quite know how it's going to be because I've had 18 months of treatment. I don't know what Leslie looks like after having all that treatment. So Leslie before was, festival going, very social, whereas I don't know. I'm hoping I can go back to being that an element of that person again, but it's about finding the new normal, really.
That's it.
It's the new normal.
And you've got to keep positive.
Absolutely. But also allow yourself the anger and allow yourself to go through those stages of grief, because it took me a while to get to that as well, because I think I was trying to navigate how everybody else was feeling around me rather than thinking about myself, and it took me a while to feel anything and to go through those stages of grief after my diagnosis. Really, I was worried about the family and the friends and how they were feeling rather than thinking about myself, but I've always been like that throughout life. So
interesting that you say that, you've just been given this diagnosis and you're thinking about the impact on not you but the impact on your loved ones.
Yes.
And that's quite a burden to bear, isn't it?
It is a little bit, and it took me a while to realise that actually this is happening to me. It's not happening to them, it's happening to me. And now, obviously quite a bit further down from my diagnosis, you do learn to become a little bit more selfish about things, in a positive way, I guess. I do obviously think about everybody else around me, but this is happening to me, and you have to become a little bit more selfish with
I
life.
think so, yeah.
Yeah.
And just going back to you, Charlie, because your situation was you've got this medical background with your family or medicals as well. I mean, has that been good, or would you say that at times that's been quite tricky, them having all this medical knowledge?
From my perspective, I think it's been good because we could understand, and as I say, unfortunately, we do have a lot of cancer in our family, and we have been genetically tested now for various things. The irony is, I have the PMS2 gene, which basically is connected with Lynch syndrome. But the irony is that the Hodgkin's that I've had and the EGFR cancer that I've had currently isn't deemed to be connected with the PMS2 gene. So PMS2 leaves you greater risk of colon cancer, GI type cancers.
Wow.
So you're at a higher risk than the general population for those. But I think because of that, and almost, dare I say it, and I hesitate to say this because there's all those, the thoughts around tempting fate. We have a high instance of cancer in the family, but we have a high instance of living with cancer in the family.
Okay.
So actually, that's almost a flip side to the narrative. And I have to say, I was diagnosed 2 years ago, and unfortunately, with stage 4 lung cancer and even EGFR, it very much depends on whether the targeted treatment works for you or not, as to your longevity. And so I sort of go, even now, I would count myself in the longer surviving people with a stage 4 lung cancer diagnosis. So that is quite often at the back of my mind. So I think being able to read into things, being able to understand statistics comes from that sort of scientific med side of my family. I think where it is, the flip side of it is that for them, that feeling of control, they can't control this, they can't actually help me. And cancer is such an individual journey from the point of view of the metabolic response to the cancer. But keeping, they're all on this with me, they're all supporting me, doing everything they can for me. But absolutely, it's an individual fight at the metabolic level and a cellular level. So that's, I think, the flip side of, I don't know whether that's good or bad. Unfortunately, I have to ask them.
Yeah. Interesting. No, and interesting that you say about the longevity, and that actually, yours is a positive. And Doug, you're similar, aren't you? Because you've got through 2 years of immunotherapy, and a lot of our mesothelioma patients don't get through 2 years of therapy. So to have you with us today, both of you being able to share that message, and Leslie, you're here and you're well, and you've got through your first treatment and your chemotherapy. I think that's real positive message to give to people.
Yes,
If they're just
absolutely.
newly
without a doubt.
diagnosed.
Yeah, definitely.
And just thinking back about that, thinking about the thousands of people in this country that are diagnosed with lung cancer and mesothelioma, and even, other cancers. We know that, the Macmillan are saying 1 in 2 people will be diagnosed with cancer in the next 10, 12 years. If you had to go back and you were at the beginning again, where you'd just gone to the GP and they were saying, we think things might not be as they should be, and the word cancer starts being mooted, what advice would you all give to somebody to help them feel, a bit reassured, or if there are any hints and tips you'd give someone?
Can I go even one stage back?
Yeah, go.
Because I think even turning up at the GP,
Right.
for some people, especially with lung cancer, they may not.
Right.
And my personal advice for the 2 I've been through is putting your head in the sand doesn't help. So very much this, Doug, you hinted at it earlier, it's happened. Not doing anything about it doesn't change the fact it's happened.
No, it doesn't.
Going and seeking help gives you a much better chance of, so catching cancer early is really where I'm coming from, or even starting treatment. So I do think there's that step before where if you're worried at home that you've got something, worrying about it doesn't do anything apart from taking the time away from you of enjoying life. Going and dealing with it is much more important. And then absolutely that word, as soon as it's out loud, is scary. Let's face it, cancer treatment, there are no easy cancer treatments. Mine's great, but there's still side effects to it. But would I prefer those side effects to not being here? Absolutely.
Right.
Yeah.
100%
Absolutely,
every
I
day.
I completely agree with you there.
I mean, I think I had just about every side effect you can have.
Yeah.
oral thrush, diarrhea, sickness, weight loss, rash. I can't remember them all 'cause there's so many. Most of them are gone. I still get the rash. I mean, I've been just seen a dermatologist, and it's getting better. But he says he's never going to cure it. You've just got to live with it. Just keep whacking the cream on and taking the pills.
I was going to say, are they manageable side effects compared to the alternative?
Yeah, I mean, sometimes I sit there and I think, oh, give me a wire brush, but yeah.
You're here.
Yeah.
Yeah.
Absolutely.
Yeah.
And like you say, you're better off living with them than without them.
Oh,
Not
absolutely.
living.
I would say
Yeah.
that. I mean, the immunotherapy, I got hepatitis quite badly last year, and obviously the crippling arthritis. But like I say, I'm still here, and the chemotherapy side effects, they were manageable. Not very nice, but they were manageable. And would I do it again? Absolutely, if it gives me longer.
Lovely, thank you. So I guess we're saying to people out there who may be sat at home and scared, like you said, Charlie, better to go and find out while you're well. We know that there are treatments now, which I think in the past, a lot of lung cancer and meso patients, there wasn't that. So there was that fear of going, because what the hell are you going to do about it? But now we have treatment. So, yeah, I think that's a really good message to end on. And, yeah.
There's just one more
Yeah,
step
go
from that
for it,
as well.
Charlie, yeah.
With Dr. Google being so readily available, if you search any symptom, at some point cancer comes into that conversation.
Yeah.
And there's also that bit about being at home worried about cancer and not having it is absolutely a waste of your life.
Yeah.
So go and get checked,
Mm.
and definitely go and find out for sure. And then hopefully you'll get better news and it's something much more manageable, treatable.
Yeah, I would think knowing is better than not knowing. Totally.
Yeah.
If you just sit at home and worry about it, it's not.
Get a
it's
second
not a good
opinion if
thing.
you're not happy with the first
Yeah.
opinion. Get a second opinion.
Yeah, there's plenty of
you know?
people out there can
Absolutely.
help you.
Yeah.
Yeah.
You've just got to get off your butt and go
Yeah.
and get the help.
Yeah.
Yeah.
As you say, it's no good sitting at home
No.
thinking, oh, well, no, it's not anything. Because 9 times out of 10, I'm afraid it is.
Yes.
And it's
Yeah.
better to get the early treatment, early diagnosis,
Yeah.
and I think you got more chance.
Brilliant.
Yeah.
Well, thank you. It's been brilliant. And thank you so much for sharing all your thoughts today. And that brings us to the close of our first podcast. We hope that you'll come back and join us again. We hope you found it reassuring and helpful. So thanks very much, everyone. We'll see you all later. Bye.
Thank you.
Thank you.
Bye.